Hello everyone, this is I Will Teach You Medicine, and today on the ENT series we are discussing about the diseases of the external ear. So let's start. So in the diseases of the pinna we have the classification that can be on the pinna only. So external ear means pinna, external auditory canal. So in the pinna, let's talk about that. So we have the classification that is either congenital or inflammatory, or due to traumatic, or due to miscellaneous cause. So diseases of the external ear, that is pinna can cause accessory auricle. So extra like auricle can be found, and bat shaped ear, like a bat, that we will like discuss with the pictures below. And the preauricular sinus, if this is external ear, then there will be a sinus. Anosia and microtia means anosia means like absence of auricle, and microtia means small auricle. So coming to the inflammatory disease of the pinna that can cause perichondritis. So perichondrium, that can be itis, that means inflammation can occur. So congenital and inflammatory. And in the neoplastic we can either have squamous cell carcinoma or basal cell carcinoma. So these are two types of like cancer that is commonly found in the pinna. And another is traumatic causes, traumatic causes that can lead to diseases in pinna, that is either hematoma, that is collection of blood, or laceration, any kind of injuries like lacerate the muscle and the like auricle and other perichondrium, etc. And in the miscellaneous, it can be either sebaceous cyst or keloid or pseudocyst. So that is the classification of the diseases of the pinna, that is congenital, inflammatory, neoplastic, traumatic, and miscellaneous. So let's revise. Congenital means accessory auricles, bat ear, and then sinuses can be formed, and anosia means like small like absence of auricle, and microtia means no auricle. And and then in the inflammatory, due to any kind of like infection that can cause the inflammation of the perichondrium, that is perichondritis. And in the neoplastic, it is either squamous cell carcinoma or basal cell carcinoma. And in the traumatic, it is can be either due to hematoma, like any kind of hematoma can be formed, and laceration. And in the like miscellaneous cause, it can be sebaceous cyst, and keloid can be formed, and also pseudocyst. So after pinna we will come to the disease of the external auditory canal, EAC. So what are the causes? So any kind of disease that can occur in EAC, so they are either congenital, traumatic, inflammatory, neoplastic, and miscellaneous, just like the pinna. So in the congenital, that can be congenital atresia, means no like atresia can happen, and then the stenosis of the EAC. So that is due to congenital cause. In traumatic, it can be either iatrogenic or accidental, that is like some kind of surgery related. So if a surgeon like does some kind of like a mistake, not like not willingly, it happens, like sometimes we are human beings, right? So accidentally it can happen, so it can causes the disease of the external EAC also. And in the inflammatory disease, it can be otitis externa, so OE, otitis externa can happen. And also in the neoplastic, it can be either osteoma, squamous cell carcinoma, and basal cell carcinoma. Osteoma, okay. So like in pinna we only had squamous cell carcinoma and basal cell carcinoma, but in the action or EAC there can be osteoma. And in the foreign and in the miscellaneous, we have wax. Wax can cause some diseases, and then foreign bodies, and then acquired atresia. So it some like pathology can also cause atresia. And in congenital, it can occur congenitally. And exostosis, so we will discuss about it down. So classification, so we will study about the otitis externa, so that is the inflammatory condition. So we will study about the classification of the otitis externa. So there are the 5 classification of otitis externa. Wait a minute. Otitis externa. So one is localized otitis externa, means only like in the external part of the ear there is a localized inflammation. So that is known as the furunculosis. So furunculosis is the disease of the like external ear. Otitis externa, that is localized. So furunculosis is localized otitis externa. And then there are some kind of like otitis externa that is not localized, so we have to say it's diffuse otitis externa. We are reading about the classification of the otitis externa, right? So it is either localized or diffuse. So in localized, it is furunculosis, and in the diffuse otitis externa, it is like further classified into idiopathic. We don't know why it is have happened. It is either due to infective, that is due to infection due to bacteria, fungus or virus. And then in the traumatic also, and irritant, allergic, climatic and neurodermatitis, that can also cause diffuse extra diffuse otitis externa. So in the infective we have either bacterial, fungal, it can be caused due to otomycosis, and viral we have the herpes zoster, herpetic otitis externa. And traumatic, irritant, allergic, climatic and neurodermatitis. So that's it about diffuse otitis externa. And then we are talking about the generalized skin disease, like any kind of like otitis externa that is not due to the isolated disease in the ear, but it is due to the systemic skin disease, generalized, that happens not only on the ear but also the whole body. All right. So we have a condition called seborrheic dermatitis and eczematous dermatitis. So it can be either like sebo. You can by heart this if you haven't like studied dermatology, like most of the KU students. I don't know about the TU. So seborrheic dermatitis and eczematous dermatitis, this is easy. And atopic dermatitis is like allergy induced dermatitis, skin will be like inflamed and all that. But atopic, that is also seen in like asthma. All right, atopic dermatitis. And also we also have this condition known as psoriasis. Okay, so you can like by heart this. Okay, generalized skin disease that also causes that otitis externa, so that can be either eczematous dermatitis, atopic dermatitis, psoriasis and like seborrheic, seborrhoeic, seborrheic dermatitis. So that is also one of the causes of the generalized skin disease. And in the other classification, so okay, let's discuss. Okay, otitis externa, so they are classified into generalized, localized and then diffuse. So generalized means all the skin diseases that are not only in the ear but also the whole body. Localized means furunculosis, and diffuse that can be caused due to either many factors, that can be either bacterial, if under infective, that is bacterial, viral, fungal, and there is any we have idiopathic, infective, traumatic, allergic, etc, etc, etc. Okay, so this is an easy thing. So another is invasive, so that can cause like invasion. This is a very dangerous. Okay, so that can be benign necrotizing otitis externa and malignant necrotizing otitis externa. So you can by heart this. All right, so invasion, it causes invasion either benign or by malignant. All right. And so in others, others, it can there are condition called as keratosis obturans and bullous myringitis and granular myringitis. So keratosis obturans, bullous myringitis and granular granular myringitis. So that's other, that falls under other. All right, so let us revise. So in otitis externa, it can be either due to localized or diffused or generalized whole body, gen generalized, or it can be invasive or others. So localized is furunculosis, diffuse is all the bacteria, viral, fungal, infective, idiopathic, traumatic, allergic and all. And in the generalized it is due to psoriasis and eczematous and other atophic and then seborrheic dermatitis. And in invasive it can be either benign or malignant. And in the others, that is myringitis. Okay, so others means myringitis, that is bullous and granular and keratosis obturans, KO. Okay, so that's the revision. Okay, so you can do that. So in the embryology of the pinna and the external auditory canal, that is due to the wait a minute. So talking about the embryology of the air, so most of the air comes from brachial arc system. All right, so there are 6 brachial arc, out of which like number 5 of the brachial arc system that disappears. So this is number 1, this is number 2, and then this is, wait a minute. Okay, so this is number 1, this is number 2, this is number 3, this is number 4, and 5 is absent. All right, this is absent. absent, and then we have number 6. Okay, just like written, number 5 disappear. So most of the air comes from the brachial arc system, in which there are 6 brachial arc, out of which number 5 disappear. Okay, so this is a brachial arc, this is a graphical representation. So I have color coded. All right, so this is ectoderms, and this is the mesoderm, the black one, and this is the endoderm. All right, so we can see here, this is the ectoderm, mesoderm, and this is the endoderm, the blue colored. So now we have another names for ectoderm, mesoderm, and endoderm. So ectoderm means ecto, ec. So in ectodermal means cleft. All right, and then the endodermal means pouches or groove. So we have to like name it. So ecto means cleft and endo means pouches or groove. So what happens is, the first cleft means ecto. All right, so the first cleft. Okay, so the first cleft and pouch grows towards each other and meet. So this is the ectodermal and this is the endodermal. So this both come and meet at the first first brachial arc system. All right, and then when they meet together, so you can see this is ectoderm, this is the mesoderm, and this is the endoderm. So when the ecto and endo are meeting, the mesoderm, it is getting trapped in between the two. So in the development process in the embryology, so when they are trapped, so it makes this portion, makes the this meeting makes the tympanic membrane. All right, so and the middle layer is trapped. So this becomes, or this develops to form a tympanic membrane. All right, tympanic membrane. And how many layers are there? So tympanic membrane, so they meet to form a tympanic membrane. So the tympanic membrane has 3 layers. So this is the basis of like embryological basis of like why does tympanic membrane has 3 layers. So we will discuss about how the external auditory canal and pinna are formed. So first cleft, that is cleft means cleft means ectoderm. All right, so first cleft develops to form the external auditory canal, and the first and the second brachial arc, they fuse together to form a pinna, and in the first brachial pouch, the pouch, they form the middle layer and the eustachian tube. So this is the embryological basis of the external auditory canal and pinna. So now let's get back to I think I have made this clear about the embryology of pinna and external auditory canal. So let's get back to the diseases of the external ear. So accessory auricle and skin tag. So you can see this is very this is very much common. So accessory auricle and the skin tag, you can find it like on your relatives or someone, any child can have it. So you have, whenever you see like this, tag. So this is a skin tag or accessory auricle. Here also you can see this is the skin tag, auricle. So skin tags doesn't have a cartilage within. All right, so now let's talk about the microtia, means small auricle. So here we can see this is the like auricle, and this is like relatively small. Okay, like a face of the person is not shown here, but we can like make out of it that this is a very small auricle. All right, so grade 1 and 2 of the microtia, it is as it has been labeled, and grade 3 and 4, so it is like nothing, like existence, like there is no existence of it. Look, so small auricle, so microtia. And then how do we like reconstruct it? All the surgery doctors and the cosmetic department, cosmetic surgeons and the ear surgeons, they take out the rib graft, for 4 stage reconstruction of pinna. So this is like graft made, so they will be attached to it, and then this is like we don't need it in our level for the like MBBS level, but also it is good to know. So stage 1, construction of the cartilaginous framework. They are constructing the cartilaginous framework, and then here is the creation of lobule. They are making like all sketching and all, and then creation of a post auricular sulcus also, and then creation of the tragus. So they also make the tragus, and then polyethylene graft. Okay, so they also use polyethylene graft for 2 stage reconstruction of pinna. And yeah, so EAC atresia means no opening. All right, so this is also seen in the external auditory canal atresia. So now let's talk about the bat ears. So bat ears means like this, just like a bat. And then surgical correction of bat ear, this is before and after, very nice to see. And okay, so now let's talk about the preauricular sinus. So what is a sinus? You will have to read this in surgery as well. So epithelium lined blind tract blind tract. All right, this is a blind tract with opening at root of helix. So wherever the root of helix is, there will be an opening, that is a epithelium lined blind tract caused by the incomplete fusion of the hillocks or tubercles of his during his development. So why is the like preauricular sinus formed? So it is caused by the incomplete fusion of the hillocks, okay, or tubercles of his, tubercle of his hillocks, or this is the keywords, all right, tube or tubercles of his during the developmental process. All right, and there is like for the treatment, it may be okay. So preauricular sinus, okay, so there is a sinus, okay, it is a blind tract, so this is an sinus, so it is blind, okay, and here sometimes infection can present, and sometimes like discharge can come out of it, and then abscess formation can occur. All right, so many things can occur in the preauricular sinus. So this is also a disease of external layer, right? So we have to like take care of everything in the ENT department. So we have to know about the preauricular sinus also. So treatment, what is treatment? So treatment is meticulous surgical excisions, means we have to like surgically excise the entire tract along with a portion of auricular cartilage and skin around the opening. So we have to like surgically like excise the tract and along with the portion of auricular cartilage and the skin around the opening. So yeah, this is the preauricular sinus. So in the tragus, so you can see here, and it is a blind tract, and here like abscess and infection can occur from here, you know. And so it's surgery is to do the meticular excision along with the tag like skin and the cartilage, and like we can like get rid of it. So whenever it gets infected, we can see a cyst, okay, as shown in the figure here. It is already marked, but still this is like all due to the like formation, you know. And so the patient presents with like cyst. And okay, so that's about the preauricular sinus and like with cyst. So hematoma of the auricle. So hematoma means what is hematoma? Hematoma means blood, collection of blood. Of auricle means in auricle. So why does it occur? So it is occurs due to the subperichondrial collection of blood in the pinna following like any kind of external blunt trauma. Okay, blunt trauma, you will read about trauma in forensic as well if you are a third year student in KU. So okay, so hematoma of the auricle, that is due to the subperichondrial collection of the blood in pinna following external blunt trauma. All right, it is due to the subperichondrial collection of blood in pinna following external blunt trauma. So it presents as a tense, it is very like painful, all right, painful swelling of the pinna. So it is seen in like whoever experience blunt trauma. So in boxers, wrestler and rugby players, not so common in Nepal, it's for USA. And boxers, you know, wrestlers, and sometimes like police officers, if they are like fighting, you know, and all the gang fights and all, they present with hematoma of the auricle. So its infection, it can lead to perichondritis. So its treatment is like the main treatment is like systemic antibiotic. You have to like run like antibiotic to the patient, okay, which it's very important. And like it's an emergency condition, you know why? For because we have to do the aspiration and incision, like incision, IND, incision and drainage we have to do. So hematoma is we have to drain the blood as soon as possible. And pressure dressing, we have to like apply the gauze on the like very much pressure so that no blood gets remained inside the like perichondrial layer, subperichondrial layer. So if the hematoma of the auricle is not treated, then we can like have complications, like we can get cauliflower ears. Why? Because it is due to the fibrosis and deformed pinna, okay. So there can be infection can occur and fibrosis happens, so that will lead to the deformed pinna, and like aesthetically also like the person will like will suffer. So it will cause cauliflower ear and boxer's ear. So whenever if you are an like medical officer in an emergency room, you know, emergency department, so and any kind of person who comes with the hematoma of pinna, we have to like ASAP stat or whatever you like to call it, we have to stat do incision and drainage with systemic antibiotic with pressure pressure dressing, okay, pressure dressing with gauze, pressure dressing. So yeah, that's about it. Now like yeah, we can see this is the hematoma of the pinna. See all the subperichondrial like collection of the blood is seen here, and here is also seen. So we have to, what is the treatment is incision and drainage and antibiotic, that is systemic, and pressure dressing. Yeah, so sorry about my handwriting. I hope it's like making sense to you. Okay, so now let's talk about cauliflower ear. So if the person or the patient with like hematoma, hematoma of the external like pinna isn't treated, so what will happen there? There will occur fibrosis plus deformity of the cartilaginous framework. So that will lead to like infection, and that will lead to cauliflower ear. So it looks like cauliflower, right? So all bumpy and like all like this. You can make a cauliflower out of here. Yeah, like this is a cauliflower. I'm sorry for my like extremely bad drawing, but I'm just trying to give you like examples. So how would have we like prevented the cauliflower ear? We should have done incision and drainage, systemic antibiotic, and pressure drainage. All right, that's it. So yeah, look at here, it's all how it is treated and all. Now, perichondritis of the pinna. Okay, so let's talk about the perichondritis of the pinna. So how does perichondritis happen? So what is perichondritis? Means inflammation of the perichondrium of pinna. Okay, due to the incised or lacerated wound, hematoma, otitis externa. So in the previous, like we had hematoma that caused like cauliflower ear, so that is also perichondritis, right? The bacteria caused the inflammation of the perichondrium. So yeah, and not only due to hematoma, it can be also due to the like lacerated wound, which is caused by the blunt trauma, and also otitis externa. So its classification we already read, localized, generalized, and then diffuse, and all. We can revise that. So what happens in the perichondritis of the pinna? So it presents with the severe otalgia means pain of the ear. Erythema means all the collection of the blood, and local rise of the temperature in the pinna. So in the like whenever a patient presents to the like OPD of the ENT department, like when we do the ear examination, it is very crucial to like like palpation. You have to like measure the rise of the temperature of both pinna. So why? So if there is a rise in the temperature, local temperature, then we can say like it may be due to the perichondritis of the pinna. So yeah, that is also very important. And I'm so sorry, someone is getting married in the background, but let's continue. Subperichondrial abscess may form with the necrosis of the avascular cartilage. So, subperichondrial abscess. So, due to any kind of like inflammation of like any kind of lacerated wound, hematoma, or otitis externa, will cause what? It will cause abscess, and it will also form with the necrosis of the avascular cartilage. So, there is like some cartilage, like auricular cartilage. Sorry. So, in auricular cartilage, we can cause like what happens there? Abscess happens, and then what leads to it? Necrosis. Okay, I think we gotta stop for some minute. I will continue after the janti passes by. So please stick with me. So let's talk again on the topic. Sorry for the disturbance. So presence with severe otalgia, erythema, and local rise of temperature. So in like it can lead to the subperichondrial abscess and may form necrosis of the auricular cartilage. So what is the treatment of perichondritis? All right, so perichondritis means inflammation, so it can be, so we have to treat with systemic antibiotic and aseptic incision drainage of the abscess, and removal of the necrosed cartilage. So we have to excise the necrosed cartilage as well. So this is how what perichondritis looks like. All these are like erythematous, and then it is swelled up a little bit, and there must be on palpation, there must be like local rise of the temperature and all. So yeah, this is due to the like abscess formation, and some of the necrosis are also taking places. So treatment is systemic antibiotic plus aseptic incision and drainage of the abscess, and removal of the necrosed cartilage. All right. So now if like we have treated, all right, so we have treated the perichondritis. So relapsing, sometimes it is like like it can relapse, and not only in the like perichondrium, but also we have named it like polychondritis. Okay, so poly means many like chondrium. So relapsing polychondritis means Autoimmune disorders of the cartilage can cause polychondritis, not only limited to pinna but also to other places where there is like perichondrium. All right, so pinna number one. Second is cartilaginous aortic capsule, aortic capsule. And then in the nose we have like perichondrium all there, and laryngotracheal tree, and ocular inflammation can also occur, and polyarthritis nodosa. So the treatment, so it is an autoimmune condition, right? So we have already learned from the basic science that any autoimmune disease or any diseases or conditions we have to treat with the steroid. So the best steroid is prednisone, that is 1 mg per kg per day. And also like plus or minus depending upon like what is the cause, we have to give dapsone. Okay, dapsone is an antimicrobial agent, especially used for mycobacterium, leprae and all. So okay, now let's talk about frostbite of pinna. All right, frostbite means as we are in Nepal, we are countries of Himalayas and all, like top 10 peaks, like highest mountain in the world. So this is like we have like learned about frostbite and anywhere. So if you are, imagine if you are a doctor in like Solukhumbu or some district, Himalayan region. So like you are present there with a patient, who has a frostbite of pinna. So yeah, so you have to treat them, right? So you have to study about the frostbite of pinna as well. So what is the reason for the susceptibility of a pinna to get for frostbite? सो वाइ किन त्यसलाई मात्रै हुन्छ, पिन्नालाई किन धेरै चाहिँ फ्रस्ट बाइट हुन्छ, किन ससेप्टेबल छ होइन? सो वाइ, बिकज इट्स सर्फेस एरिया टु मास रेसियो इज भेरी हाई. सो इट्स सर्फेस एरिया इज मोर, सर्फेस एरिया अफ एयर इज मोर than its mass. All right, and the blood vessels lie superficially in subcutaneous tissue and increasing their exposure to cold temperature. So blood vessels are very like superficially, all right, so superficially in the subcutaneous tissue blood vessels, so it can cause like so their cold temperature, if it was located deep, then it can have like less exposure to the cold temperature, right? But it has in the subcutaneous tissue, so blood vessels that lie subcutaneously will get more exposure to the colder temperature, and it can get frostbite. And prolonged exposure blocks the sensory nerve supply, yes, and reducing the pressure. Okay, so at the same time, so pinna, let's suppose this is a very good drawing of a pinna. Okay, this is auricle and all. So what happens is its surface area. Okay, 3 points, there are 3 points that causes like susceptibility of pinna for frostbite. Number one is surface area to mass by mass ratio is high ratio, all right? So that causes number one reason. Number two is like the blood supply, blood supply that is supposed to keep give nutrients as well as give heat to the organ. So blood supply is like very superficial, that is in superficial, that is on the subcutaneous layer. So it can like increase the risk of increasing their exposure to cold temperature, right, as it is written. And the number third is like on the on cold surfaces, cold temperature, that it prolonged exposure, it will have less sensory nerve supply, it has less sensory blood supply, like blood, your sensory supply is less, all right, it is less. So you can like the patient won't know, like he can't recognize, oh my god, my ear are freezing. No, because why? Because it is due to the like exposure will cause blocked sensory nerve supply, so patient awareness is not present there. So it can like be one of the reason for the susceptibility of pinna for the frostbite. So pathogenesis, how does this exactly occurs? Vasoconstriction in the cold environment, vasoconstriction, and due to extracellular ice formation, ECF, extracellular fluid, that will cause icing happens, and then cell will die. All right, vasoconstriction, no proper blood supply, extracellular ice formation, that will lead to the cell lysis. And if we warm it, on warming, the extravasated fluid causes edema. All right, so like it has already lysed, all right, so in the extracellular ice happens, so it will cause edema, all right, the pinna or the auricle will become edematous. So after edema, on heating, it will form bulle formation, that will lead to the tissue necrosis. So that's frostbite, right? Okay, let's just see some like frostbite images of here. So you can see here, this is like in the early stages of frostbite, edematous we can see here. So generally frostbite also occurs in other organs, like look here in the fingertips and the legs. So it is on the process, all right. So frostbite is not only limited to ear but also other organ, but yeah, it is on the like early stage of frostbite. So you can see here, you can like see here, it is like edematous, you know, edematous. So it will lead to like extracellular fluid. There is ice, ECF, extracellular ice happens. So on warming it will cause lysis happens, then bulle formation, bulle, then it can cause frostbite, necrosis and frostbite, all right. So let's continue with our slides. So, what is the treatment of frostbite of the pinna? So, rewarming with moist gauze piece at 38 degrees Celsius. So, the suitable temperature is 38 degrees Celsius. We have to do it with a moist gauze piece, not with air. Okay, and avoid radiant heat. So, we don't have to radiant heat like on an electric heater or with a fire. No, we can't do that. So, what will it cause? It will cause worsen the injury. All right. So, this is a very useful tip, and so 1% is sulfadiazine 1% is silver sulfadiazine cream should be applied for the superficial infection. So what will it cause? It will cause the rupture of the bulle lies, it will avoid. Okay, 1% is silver sulfadiazine cream application for superficial infection, that will cause the avoiding the rupture of the bulle, so tissue necrosis will be less and less infection can happen. So, and analgesic, so the person will be in intense pain, all right. So patient will feel very much pain on the ear, so which can be caused analgesic. So rapid rewarming, while we are rewarming, rapid rewarming at 30 degrees Celsius, the patient will feel pain, so we have to like give him analgesic for that, Flexan or antibiotic like paracetamol, ibuprofen, or any type of NSAIDs. So systemic antibiotic against Pseudomonas and Staphylococcus aureus for deep infection, all right. So we have to do the prophylaxis as well. So we know infection is about to occur, so we have to do the systemic antibiotic against Pseudomonas and the Staphylococcus aureus. Okay, Staph aureus and Pseudomonas, they are the worst enemies for the mankind, I would say. So now let's go down. So, and surgical debridement, okay, with like any kind of necrosed tissue, we can't leave it in like the patient. So only after demarcation between dead and living tissue occurs over months, so it can occur within months, so there will be a gap, all right. So if this part of the ear is healthy and this part is necrosed, so we have to cut the necrosed part. So we can see it by demarcation after months, all right, over months, it occurs over months, so we have to wait for that. So now after the frostbite of the pinna, we have to read about the pseudocyst of the auricle. So pseudo means false, false. Cyst means cyst, any kind of like cystic swelling in of auricle. So what is pseudocyst of auricle? So it is a very painless intracartilaginous cyst. So it occurs within the cartilage, it is very painless with no epithelial lining. There is no epithelial lining in the cyst, so it presents over the anterior aspect of the pinna. Okay, pseudocyst of the auricle, and occurs spontaneously due to the low grade trauma, or it is due to the low grade trauma, any kind of low grade trauma. Sorry for the tongue twister. Occurs spontaneously due to low grade trauma or embryonic dysplasia. So it can either occur due to the developmental abnormality or due to the low grade trauma. Okay, and so what is this treatment? Treatment of the pseudocyst of the auricle is surgical excision, we have to cut it, and compression bloster or button compression. So we have to do like button compression. I don't know if you are familiar with that concept. Let me show you. So here we can see very good image, literally a button is tied, so auricular pseudocyst anterior button placement, it is done. You literally have to like put a button. Look here, this is the auricle, and there we are seeing the treat auricular pseudocyst treated with buttons, so it will like cause pressure over it, all right. So that is the treatment. So moving on, it can so on the pseudocyst we can't do simple aspiration, so it will lead to it may subside for 1 month 2 months, but it will cause reoccurrence. Okay, recurrence. So it is like that. So pseudocyst of the pinna, look, this is a pseudocyst, and this is after surgery, it has been removed. So now let's talk about keloid. Okay, these are all very important, not only in ENT but also other subjects, and also mainly specially surgery. So what is keloid? Keloid is the result of overgrowth of dense fibrous tissues, all right. So it is a overgrowth of dense fibrous tissue that develops after healing of skin injury. So any kind of skin injury, surgically keloid that you will lead in surgery. So develops after healing of skin injury. Tissue extends beyond borders of the original wound and does not regress spontaneously. So any kind of skin injury, suppose this is your skin, here occurred a skin injury. So what happens here, the like on like skin, whenever there is like any kind of injury, there can be like a healing process, all right. So in the healing process, fibrous tissues like grows and bands together and all. You have read that in from like Robin's pathology and like Bailey and Loeb and all. So the dense fibrous tissue, when they are banding and like growing, so what happens here, it will overgrowth, it will overgrow beyond the original borders of the open, like beyond the borders of the original wound, and this does not regress spontaneously, all right. So that is keloid. So what is keloid? Keloid is a result of overgrowth of dense fibrous tissues that develops after healing of skin injury. Here the tissue extends beyond borders of the original wound and does not regress spontaneously. Okay, so that is a keloid. Okay, and what is like we have the same thing as yeah, look, so this is the keloid, all right. All this is keloid. So and another we have like one other kind of the same type, hypertrophic scar. So hypertrophic scar can also occur, so that is erythematous, red in color, pruritic, raised fibrous lesion that does not expand beyond the boundary of initial injury and may undergo partial spontaneous resolution. So it is like raised fibrous lesion only, that does not expand extends beyond the boundary. So keloid, it extends beyond the borders, but here the hypertrophic scar, they don't expand beyond the boundaries of the initial injury and may undergo partial spontaneous resolution. So it will go partial spontaneous resolution, but keloid won't, all right. So this is the keloid. And treatment of keloid. So what is the treatment of keloid? So we tend to reoccur after surgical excision. So it's very like ziddy type, so it tend to recur after surgical excision. So we have to prescribe them like any kind of drug also. So that is the triamcinolone acetonide, triamcinolone acetonide, that is 40 mg per ml, administered intralesionally with a 26 gauge needle at 4 to 6, so at 1 month interval. We have to take a syringe, you know it's a very shitty drawing of a syringe. So intralesional, we have to administer the triamcinolone acetonide at the 1 month like interval, 4 to 6 weeks. So that is there is also new treatment. So that is intralesional lesional interferon, that is 5-fluorouracil or doxorubicin or bleomycin. These are all like anti-cancer drug, retinoic acid, tacrolimus, taxomifen, botulinum toxin can be also be used, and intense pulse light, IPL, not the cricket one but the IPL. So UV light is also a new treatment. So it's many kind of research are happening. So yeah, you can say intralesional interferon is also prescribed, and fluorouracil, doxorubicin, bleomycin, whatever anti-cancer drug in mind, you can like remember for your level now in MBBS. So now let's talk about the furunculosis of the external ear. Maybe we should stop this with, where are we are on the page number 37 out of 87, 50 more, right? Okay, let's like study this furunculosis, and then we will make a part 2 of disease of external ear. So okay, furunculosis, this is very important, and you can see it everywhere, like in the ENT OPD you can see that. So why does furunculosis occurs in the external ear? So hair follicles, the external auditory canal, that external ear, that is total of 24 millimeter, right? 24 millimeter length. So there are two parts, 1/3 and 2/3, 1/3 and 2/3. So 1/3 is 8 millimeter, and the internal 2/3 is a bony like external auditory canal, that is of 16 millimeter, right? So in the external 1/3 of the cartilaginous external auditory canal, you have the like skin lining it towards it, all right. There is skin, and what occurs in skin? Of course, hair follicles. Hair is there, all these are hairs. And what happens is like in the external ear, due to the presence of the skin, it is a like cartilaginous EAC, their hair follicles is there, so any kind of staphylococcus infection can occur in there. So furunculosis always occurs in the external 1/3 of EAC. All right, so that's an important thing to know. And recurrence seen in diabetic and in patient with nasal vestibulitis. So if you see a patient with a patient that comes over and again, in your OPD, always for like furunculosis, over and over. So you have to like not only just treat locally, but also you have to like order investigation for blood glucose level, fasting and all. So you can like like diabetes is a very like big disease, like it has so many systemic complications and all. It can either cause you like complications in kidney, complications in your eyes and all, so many things. So like if a patient presents with you on your OPD with like furunculosis that is reoccurring, so you should, as a physician, you should always remember that like what if the patient has diabetes. So it's not your duty to just treat ear, right? You are not just a doctor of ear, but you are primarily a his doctor, no? So you have to take care of the patient, so you have to send a blood like blood glucose level report also. So you have to keep this fact in mind, this information in mind. Okay, now so much talk. After so much talk, we will like get to the topic. So what happens in the symptoms? In symptoms we have severe otalgia, out of proportion of the furuncle size. How like small, big, no problem of the size. Okay, sano bhaye pani like dhamaka garcha type. So out of proportion of furuncle size with increases on jaw movement. Okay, so in front of the external auditory canal, your relationship of the external auditory canal, there is a temporomandibular joint, TMZ. So if you are moving your jaw up and down, so of course it will cause some movement in the EAC as well, and that will cause pain, so it is severe otalgia. So what is the sign is tragal tenderness. Yeah, we will discuss it on the like examination of the ear. So tragal tenderness, it can cause in the tragus if you apply a pressure. So okay, wait a minute, this is an ear, so here's the tragus and this is the external auditory canal. Okay, sorry for my drawing again. So if you place your finger here and press it, in the tragus, so what happens, it will cause like pressure over the external auditory canal, and that will cause pain, so that is the tragal tenderness. And the swelling in the posterior external auditory canal wall, so this is the anterior wall, this is the posterior wall. Okay, so there is will be a swelling and edema over the mastoid. Here over the mastoid prominence there will be also an edema, and with obliteration of the retroauricular group. So like retroauricular group behind the ear, so this is your behind your ear, so here one groove occurs. Okay, so here is an edematous mastoid, and then there is obliteration, means it will not be seen. This retroauricular zone groove there should be, and you could like identify, so it is not there, so it has been obliterated. All right, and yeah, that's it. And periauricular nodules, enlarged nodes, periauricular nodes are enlarged. Okay, so here are the lymph nodes and all periauricular nodes, so that will get enlarged and like tender, it will be tender on like touch, and it will can also present with abscess and otorrhea. So here is like all the like furunculosis, infection of the like hair follicles, so abscess can also come out. Okay, so yeah, that's about the furunculosis signs and symptoms. So yeah, you can see here, this is like all these hair follicles, infection, look here, and here is all the abscess formation. So what is the treatment? So treatment is 10 percentage of icthamol, 10 percentage icthamol glycerin air pack. So air packing is very important. All right, so this is the main treatment you will do on a patient with furunculosis. Okay, so what happens is like 10% is icthamol and glycerin air pack, you will like pack it in a gauze and then apply pressure over it, so it decreases the pain by splintage and decreases swelling by counter pressure and a hygroscopic action of glycerin and antiseptic action of icthamol. So this is an antiseptic and glycerin is an hygroscopic action of glycerin. Okay, so this is an antiseptic and hygroscopic, antiseptic and hygroscopic nature. So 10 percentage, so get this on your mind. Okay, 10 percentage icthamol plus glycerin air pack. This is a very important like viva question. All right, so icthamol is an antiseptic and glycerin is hygroscopic. All right, so this is the treatment for the furunculosis of the external ear. All right, and Oh, and other for the systemic antibiotic, you have to, like, for the systemic infection, you have to use a systemic antibiotic and analgesic plus local heat. So compression, warm compression, warm compression helps. In the home remedy, whenever patient comes, we are like, we as a Nepali, we always opt out for, like, home remedies. So the patient should be advised to, like, you can say, like, yes, you can always, like, apply heat, warm compression with a hot water bottle or a hot water bag or anything like that. You can, local heat can be applied. Analgesic, and analgesic can also be given, paracetamol, any kind of NSAIDs that is locally available, cheap and all. And incision and drainage, IND can always be done. All right, so not always, but depending upon the size of the furunculosis. So it's a big furuncle. So if suppose there is a big furuncle with pain and tenderness and sometimes discharge also, so you can, like, cut it and take out it. All right, yeah, that's about it. So also, it's a very important, like, topic about how, like, we can always get confused about furunculosis with acute mastocytitis. All right, so because of the signs and symptoms, you can always differentiate it. So furuncle and acute mastocytitis. All right, so in furunculosis, the preceding otitis media is absent, so there is no history of otitis media. And in acute mastocytitis, without otitis media, acute mastocytitis is not, like, it cannot happen. All right, so this is very important for acute mastocytitis history. And tragal tenderness, if you apply pressure on the tragus, this is extraordinary canal and this is the tragus. So if you apply pressure over here, trigger tenderness is present in furuncle, not on the acute mastocytitis, not on the backside. All right, so mastoid tenderness, so this is air, this is tragus, and here is the mastoid, right? This is the mastoid area. So if you apply pressure on the mastoid, so if it's there is a pain. Tenderness means a pain that is elicited, right? So a pain we are eliciting on the mastoid, if it is, like, present over the mastoid, then it is acute mastocytitis. Otherwise, if there is no pain on the furuncle, if there is no pain, then it is, like, furunculosis. All right, so again, EAC, and this is the tragus. All right, tragus. Okay, so in the post auricular groove, means there is an, behind the ear there is a groove. All right, so this is a behind your ear, and here is always be gonna be a groove. So obliterated in furunculosis, okay, and deepened in acute mastocytitis. It is like deepened. And periauricular knots, periauricular lymph nodes that are present in furuncle and absent in acute mastocytitis. And if there is furunculosis, pinna is displaced forward, but in case of acute mastocytitis, the pinna is displaced downward, outward, and forward. you know Downward, outward, and forward. And in mucoid otorrhea, like otorrhea mucoid, it is not present in furunculosis. Okay, it is present in acute mastocytitis. That's very important concept. And when we do an otoscopic examination of the tympanic membrane, okay, that's a big, this is light out sign. So you can see that tympanic membrane is normal in furunculosis. This is normal, all these blood vessels are seen and normal. But in acute mastocytitis, it is congested and perforated. All right, so any kind of subtotal, total, or partial, any kind of perforation can happen. So this is just like normal of it. And in the x-ray of the mastoid, in furunculosis, there is a normal. Okay, it is just externally only located, but in the acute mastocytitis is a serious problem. So you can see clouding of ear cells, obliteration, and all we will discuss in acute mastocytitis. So yeah, that's it. We have discussed about up to the furunculosis of the external ear, and that makes about half, yeah, 40 of the slides we have like studied. Now in the next part we will study about the next diseases. So it's gonna be otitis externa diffuse and malignant otitis externa and many more. So yeah, thank you guys for listening. I'm sorry for taking so much of your time. Like, you could always reach out to me on this channel if you have any confusion or any clarification or any kind of mistakes that I've made while made in this video, because I'm learning, and like this YouTube channel was created for the purpose of, like, studying together, like sharing whatever knowledge I have to you and what you have. Like, we can always do that two-way system, so you can always comment and, like, point out what I have done wrong, or you can, like, you can add points to it. And also, yeah, thank you guys for listening. Hope it will help you in any sort of way. uh, Thanks. Consider subscribing. We will meet at part 2.